Hi again, Dr. Nuesse here, and today we are answering the question, can you drink alcohol and still lose weight? My name is Dr. Matthew Nuesse, and if this is the first time that you are joining me, thanks for checking out my channel. I do these videos here on YouTube, so hopefully you will allow me to assist you in losing weight naturally. If that's a subject that you might be interested in, please consider subscribing to this channel, and then definitely hit the bell notification icon. That's how you will get sent an update that I have uploaded a new video. All right, so the question is, can you drink alcohol and still lose weight at the same time? The short answer to this question is yes, you can. And in my clinics, we've devised a method for patients to use to help them be able to consume alcohol and still lose weight. And I'm going to share that system with you today. First things first though, obviously it would be best if you could avoid alcohol altogether. That would make things go the smoothest. Obviously there's a lot of issues with alcohol, other health issues, especially when you drink alcohol in large quantities. So I'm not advocating for drinking alcohol, especially when you're trying to lose weight. The issue here is that this is a deal breaker for a lot of people, and it's not because people just want to go out and get hammered and party on the weekend and just, drink 12 beers and get drunk and all this kind of stuff. Alcohol is a social thing in so many cultures. It's just about going out and having a glass of wine at dinner, or you want to have a couple beers with your buddies, or something like that. So it's so much more than just getting drunk. Alcohol is intertwined, especially in our culture in America, as more of a social thing to do. So a lot of people miss out on that social aspect of it, and because of that, they don't want to go down the path of sacrificing that so that they can lose weight. So I have devised a method that I think is the best strategy to be able to incorporate alcohol for those that really feel like they want to or need to, so they're not sabotaging the results. Okay, let's get to it. I'm gonna break alcohol up into two different categories and then break those categories down into subcategories as well. Here, follow along with me, you'll get it here in just a second. I'm gonna show you on the whiteboard. All right, so we're gonna break the alcohol categories down into liquor and then beer and wine. So let's start with liquor. And then we're gonna break these two into colored liquors versus clear liquors. Okay, so there is a difference between colored liquors and clear liquors. Research has shown that we have an increased chance of getting hangovers when we consume colored liquors. These are colored bourbons or whiskeys, rums, things like that. And the issue is a substance called congeners. So congeners are substances that help color or flavor liquors that are substances other than the actual alcohol itself. So congeners cause inflammatory conditions, which can cause these hangovers, and that's obviously not something that you want to get involved with when you're trying to lose weight. You want to steer clear of added inflammation because that makes you retain water. It also, being hung over also makes it very difficult to stay on a diet plan. I mean, think of the last time that you were going through a hangover and how difficult it was just to eat, period, especially eat the correct things. So in our clinics, we have people completely eliminate colored liquors. Colored liquors also have slightly more calories. Slightly. It's slight, but they also have more calories as well. So the rule of thumb is we've eliminated completely in our office anything that's colored as far as liquor goes. We've eliminated it completely. Okay, so next we're going to move over to beer versus wine. All right, a couple points here. Wine and beer, they're similar in calories, and beer can be a little bit of a variable because there's really, really light beers and then there's really dark beers that have a lot of calories, but typically they're about the same. They're very similar in calories per volume. Here's the issue, is wine has a higher alcohol percentage by volume, so you're actually getting a little bit more alcohol in the amount of wine that you're drinking versus the amount of beer if you're drinking the same amounts. Wine also has less carbohydrates in general than beer does. And red wine also has been shown to help prevent cancer and have some cardiovascular benefits. And that's because of a substance called resveratrol. So research has shown that this can help prevent certain cancers and also has some cardiovascular benefits. So that's a good thing as well. But here, the real issue comes down to that if you're drinking the same amount of beer as wine, you're going to be getting less alcohol through the beer in general than you would through the wine. And like I said earlier, wine also is lower in carbohydrate content in general. So we have eliminated beer in our office as well. Now, let me tell you exactly how we have people utilize both wine and non-colored clear liquors. Here's what we have patients do. They are allowed to have up to 8 ounces of wine per week. So here's the issue, is typically you would be okay drinking 8 ounces of beer per week as well, but nobody drinks 8 ounces of beer in a week. I mean, that's just not a regular quantity. 8 ounces of wine is about 2 glasses, 2 small glasses, but 2 glasses. So you can go out and enjoy a couple glasses of wine with dinner a couple times a week or something like that. So 8 ounces of wine per week, we have found, and this is what I found in my office, is that does not negatively impact weight loss. Anything more than this, and this is just years and years of my observations, anything more than that will start to mitigate or start to chip away at the results that a patient is getting. So here's one choice. One choice is 8 ounces of wine per week. Choice number 2 is 6 ounces of clear liquor. So 6 ounces of a clear liquor. That's a vodka, a gin, something like that, something that's clear, that doesn't have any added flavorings or coloring to them. So vodka and gin basically. So also what I found is when patients drink in this amount and they're not adding juices and other things to their drinks, they're not mixing drinks with juices or things with other calories, that 6 ounces also does not negatively impact or does not mitigate against the results that patients get when they're trying to lose weight. Now here's the issue. We're not combining these. This is not 6 ounces and 8 ounces per week. This is a choice. You either choose 8 ounces or you choose 6 ounces per week. So you'll either be drinking liquor or wine. You're not going to do 8 ounces of one and 6 ounces of the other in a week and you're all good there. That would be double the amount that I would recommend. So that's the upper limit. Again, anything lower than that will be more beneficial, but I haven't seen any loss of progress using these parameters in patients that go through weight loss programs in my office. Okay, I hope that was a good, thorough, detailed explanation of how I recommend patients use alcohol if they choose to during a weight loss program. All right, that's it for this video. If you liked this video, right here you can subscribe to my channel for more videos, and then over here is another great video you can watch right away. And until next time, stay happy, stay healthy, and I will catch everyone hopefully in the next video.